Chapter 2: Non-Attachment. Non-attachment. Everything in this world is transient, and loss or change is inevitable. Spiritual traditions in their wisdom tell us it is our ignorance or resistance to impermanence that generates attachment, and consequently, suffering, psychological pain, and fear of death. If we are governed by worldly things which are fleeting in nature, we will continually resist the flow of life. Loss or change will then draw us back into negative emotions such as anxiety, depression, and grief. Michael A. Singer, author of The Untethered Soul, writes, "Life is continuously changing, and if you're trying to control it, you will never be able to fully live it." Our mind tends to control life experiences through clinging to and avoiding what we perceive as being desirable or not. It is then in surrendering our worldly attachments that we can experience happiness and be present in the moment. This is the biggest and most significant chapter in the book, as I believe that non-attachment is the main principle among the seven. What is non-attachment? Non-attachment simply means to be okay with or without, or free of worldly attachments, whether it be an object, car, house, etc., a person, our own bodies, thoughts, emotions, and even life. In this state, we are no longer controlled by desire or attachment by the ego. We can fully engage in life experiences with flexibility and without fixation on the outcomes. In other words, we can simply enjoy a thing without depending on it for personal happiness. We can see that the source of happiness is from within, self, and thus there is no longer fear of loss or change. Again, non-attachment is a path rather than an event. It takes practice and time to develop this wise virtue, as we are seeking progress rather than perfection. The highest spiritual path is freedom from attachment and aversion. Non-attachment has been taught as the way to enlightenment. It is a central teaching in many faiths, such as Buddhism, Christianity, Islam, Hinduism, and Taoism. It is now found in forms of therapy, cognitive behavioral therapy, CBT, and dialectical behavioral therapy, DBT, which emphasizes the ability to become detached from thoughts. Stages of psychological and spiritual growth. You can meditate or contemplate while using the concepts below, which may help you develop an attitude of non-attachment. The more you practice non-attachment, the greater your resilience to life-changing events or losses. The stages of spiritual growth help us arrive at the question, who am I? The first step in spiritual growth is coming to know that you are not the materialistic possessions you own, money, house, car, work, position, title, or degrees. The second step is in the understanding that you are not your body. You are not the physical beauty that you may have, nor the physical illness you may suffer from. The third step, a stumbling block for many, is the realization that you are neither your thoughts nor feelings. You are not the ideology held in your mind, nor are you the mental positionalities, models, or plans that you set. You are not the preconceived ideas or the conditionings absorbed from society. You are not the physical desires, nor the sexual orientation that you identify with. The intent of meditation is pure detachment from the notion that thoughts are mine or me. Ultimately, you recognize that you are well beyond that. As you arrive at the heart of the question of who you truly are, you will discover your authentic self, Buddhist self, Christian soul, Hindu Atman. Beyond your ego, with its endless collection of memories, you will find there is greatness within and feel open to the presence of self or God. This is the highest level of psychological and spiritual growth. Saints and sages of all religions have guided us to ask, Who am I? Who sees what I see? Who feels what I feel? Who dreams what I dream? Who thinks what I think? Descartes' answer: I think, therefore I am. The truth is that you are not your thoughts. You are the one aware of your thoughts. You exist regardless of thoughts. You are not defined by what you do or what you have. You are the one who is building the building. If you go to the depth of the questions, who am I? Is there something in me that will never die? For example, your soul, your spirit. You will discover that beyond the ego or mind, there is a place of pure silence, meditation, and contemplation. I believe such ideas can lower anxiety and fear encountered by those facing terminal diseases, such as stage 4 cancers, when they realize that death is not the end. Studies have shown that psychedelics used for providing therapy for terminal cancer patients are helpful tools to facilitate the understanding of this idea. Buddhism and non-attachment. In Buddhist tradition, all things in this world are subject to change and loss, and with attachment to worldly phenomena comes suffering. Buddha realized that the pathway to enlightenment is via non-attachment, and he discovered the Four Noble Truths. Those four truths teach that experiencing suffering is an inevitable part of existence. Suffering arises from attachment to impermanent things. Suffering ceases when attachment ceases, and freedom from suffering is possible by following the Eightfold Path. The Four Noble Truths. Number 1. Suffering. Life involves suffering. We always feel an undercurrent of anxiety and uncertainty inside. Number 2. The cause of suffering. Ignorance of impermanence leads to overattachment, craving, desire, and therefore causes suffering when we encounter or anticipate loss. Number 3. The end of suffering. Suffering ceases by letting go of overattachments or desire toward things. Number 4. The path. Freedom from suffering is possible by following the Buddhist Eightfold Path. For example, non-attachment, compassion, meditation, mindfulness, etc. Christianity and non-attachment. Monotheistic religious traditions have taught us that it is better to detach from worldly things, with the emphasis on attaching to the divine or God instead. When God becomes one's primary source of attachment, indeed the first commandment in Judaism, Christianity, and Islam, everything else is secondary. Jesus' basic teaching was non-attachment, to be in the world, but not of it. The kingdom of God is within you. He taught us not to attach or identify with that which is transitory, and awaken ourselves to what is eternal, unconditioned, and unchanging within, our true nature. In Christianity, the material world is not an illusion. It is a temporary level of reality, as we're only on the earth for a short time. The illusion is our perception, our attachment to this physical body or ego, or to that which is impermanent. Nothing in this world of decay is destined to last forever. Everything that has a beginning has an end. So why be attached to what is impermanent? In biblical terms, attachment is idolatry of matter, meaning to allow something relative to take the place of the absolute or God. Idolatry of matter gives rise to our pain and suffering, as we look not to the things that are seen, but to the things that are unseen. For the things that are seen are transient, but the things that are unseen are eternal. Corinthians chapter 4, verse 18. To realize the impermanence of all things can reduce attachment to and possessiveness toward worldly things. From now on, those who have wives should live as if they do not. Those who mourn as if they did not. Those who buy something as if it were not theirs to keep. those who use the things of the world as if not engrossed in them. For this world in its present form is passing away. Corinthians chapter 7 verses 29 to 31. These words remind us that our happiness and our suffering are equally impermanent. This too shall pass. Sickness, in terms of identification, can be seen as transitory. If you were diagnosed as having depression, perhaps instead of labeling yourself as a depressive, you were able to see that the disorder does not define who you are. You are not a depression. You have a depression. You are not a sickness, but rather the subject of it. A person can live better with a condition without identifying with it. It is the way we see our sickness that makes the difference. The idea is not to go into detachment or indifference, as this will lead to the path of negation. Suffering is not an illusion. The agony of humankind is real. The parable of the prodigal son is another example of the lesson of non-attachment. Luke chapter 15 verses 11 to 32. A father has two sons, the younger of whom asks for his portion of the inheritance from his father. This son, however, is wasteful and extravagant, and he squanders his fortune. He returns home empty-handed, intending to beg his father to accept him back as a servant. His father welcomes him with celebrations. The story illustrates how we seek to fulfill our happiness with things of the world, when true happiness comes from within. Detachment, indifference versus non-attachment. In your spiritual practice, it is important to understand the difference between detachment and non-attachment. Detachment can lead to indifference, passivity, avoidance, apathy, or loss of interest in life. By contrast, non-attachment does not require the renunciation of life, like moving to the caves of the Himalayas. Rather, it involves simply participating fully in life without attachment to the outcome, doing whatever would normally drive you, but without fixation and worry about the outcome. Non-attachment is an aspect of love, and it connects you to the world and people around you. Is love possible without attachment? There is often the misunderstanding that love is an aspect of attachment. The truth is that as you move toward it, you will see that true love is free of attachment, dependency, and possessiveness. You clearly see that others do not belong to you. They are free beings, and to love them is to respect such freedom. You love them without feeling over-attached or dependent on them for your happiness. You are okay with or without that person. Therefore, you first need to feel complete within yourself. Otherwise, you may seek that lack of love in others. In a healthy relationship, you complement each other rather than complete each other. Sometimes it is better to remove yourself from a relationship that repeatedly causes emotional disturbances due to overattachment, codependency, or abuse. This means you can walk away out of love for yourself. If you become overattached and feel you could not live without that person to such a degree that you must control them, this will create suffering, as everything is subject to change and loss. Again, non-attachment is the key to a happy relationship without codependency, control, possessiveness, and jealousy, and it will greatly help you practice interdependence. Secure attachment versus non-attachment. Non-attachment is closely related to secure attachment, although the two are distinguishable. People with a history of secure attachment are less likely to cling to or grasp at life. In secure attachment, the psychological term in accordance with attachment theory, a person feels confident when a partner or caregiver is nearby. In attachment theory, babies and children need to feel this bond with their mothers and fathers in order to develop a mature ego. Secure attachment is the building foundation of a mature ego. One needs a mature ego first, to more easily advance to non-attachment later in life. Carl Jung wrote, "The first half of life is devoted to forming a healthy ego. The second half is going inward and letting go of it." Benefits of non-attachment and the middle way. Reducing fixation on the need for the experience to be one way or the other brings more peace and inner joy. The Taoist quote, "The flow of life is neither sought nor resisted," means that I will be okay whether or not it happens. I let the river flow as it is. In this state of non-resistance, one is not attached to events or worldly phenomena. This is not indifference. One fully participates in life without being run by it. Buddha tried to give up all attachments by leaving his community, friends, and family to meditate in the forest with wise men. He eventually discovered that this extreme path was not necessary, nor did it make him any closer to enlightenment. He recommended the middle way by avoiding the extremes, meaning giving up over attachment and over avoidance. St. Augustine said, "I sat on top of the world when I came to fear nothing and desired nothing." By living with non-attachment, we have less fear of loss and change, allowing us to cope with the uncertainty of life, and this can greatly reduce our emotional disturbances. Studies have shown that it reduces symptoms of depression, anxiety, and stress. Instead of spending time and energy focusing on fear of loss, we become more mindful of the present moment. Non-attachment is also an aspect of true love and the key to healthy relationships. Studies show that non-attachment increases pro-social behaviors, such as empathy and kindness. This will help us avoid unhealthy or toxic codependent dynamics. An attitude of non-attachment can bring us to advanced psychological development and self-actualization. Individuals who went through near-death experiences have reported a peaceful feeling of oneness and connectedness. These experiences were reported from those able to let go of attachment to ego or body. Studies have shown that when attachment to God or a higher power is secure, religious involvement is associated with better mental health. On the other hand, when one's attachment to God is insecure, it may have the opposite effect on mental health. Exercise. What areas of your life do you feel over-attached to? What benefits can you get when you practice non-attachment? How to practice non-attachment in self-esteem, relationships, parenting, and past trauma. Non-attachment in self-esteem. Self-esteem is multidimensional, a term to describe a person's overall sense of self-worth. The need for self-esteem plays an important role in psychologist Abraham Maslow's hierarchy of needs. Maslow suggests that people need self-esteem in order to grow as a person and achieve self-actualization. Self-esteem relies on many aspects of our lives. There is physical, performance, social, personal, and religious self-esteem. Everyone defines and identifies with certain dimensions of self-esteem. We may ask ourselves the question, how do I define myself? And what positive things do I have in my life? Any attachment or fixation on the self-concept, whether positive or not, can be problematic due to the ever-changing nature of experience. If an individual clings to positive notions of self, such as being a high-performing student, then receiving a poor mark on an exam challenges this positive view. Being non-attached towards self or ego, which includes self-concept, allows us to move with the flow of life with greater flexibility. Otherwise, life changes will be perceived as a threat to self-esteem. Again, it is essential to have self-esteem to allow development of a mature and healthy ego. But there is no need to over-identify with self-esteem dimensions. Over-identifying with our physical appearance, physical health, assets, qualifications, goals, family, and so on, we become prone to emotional suffering, as everything is subject to change and loss. Over-attachment to our children will trigger fear of loss and might trigger overprotection, control, and possessiveness, which will have a negative impact on children's development. We must remember that nothing belongs to us, and that we enter the world with nothing and will leave with nothing. Strong attachment may also block us from getting what we want. Strong desire or over-identifying with any aspect of self signals to the universe and others all that we don't have, which could become a self-fulfilling prophecy in terms of remaining unable to get it all. Dimension of self-esteem. Number 1. Physical self-esteem. Self-esteem based on physical appearance and physical and intellectual ability. Number 2. Performance self-esteem. Self-esteem based on work performance or money and academic performance, high IQ. Number 3. Social self-esteem. Self-esteem based on relationships with people such as family members and significant others. Number 4. Personal self-esteem. Self-esteem based on personal traits. For example, kindness, courage, generosity, easygoing. Number 5. Religious self-esteem. Self-esteem based on religious practices and traditions. The core of most emotional disturbances is fear of loss, generated by our ego attachments and identification. If we practice non-attachment, even to self-concept, we may experience more peace, love, serenity, happiness, and enlightenment. We are born with nothing, and we leave with nothing. Non-attachment in relationships. Practicing non-attachment in relationships. Set boundaries. Being non-attached doesn't mean being detached from others. It means you value your relationship with yourself as much as with others. Set clear boundaries with partners, family, and friends, so that you have both respect and space. Learn to say no at times, and ask for what you want to maintain the relationship. When you set boundaries with others, you can express how you feel in unpleasant circumstances and explain what has generated your feelings. Avoid accusatory words, which leads others to believe that you're placing blame. Otherwise, this could immediately provoke their ego defense mechanism. Communicate in a way that doesn't cause people to feel threatened. The art of using a loving communicative tone in your relationship takes time and dedication. Spend time without your partner. There is no need to feel obliged to call or text throughout the day. Hang out with friends on your own. Don't feel the need to be with your partner or friends every day. Plan time alone for self-reflection and the processing of your feelings. Let them go if they want to leave. Never beg someone to be with you. Do not allow yourself to be abused or used, only to try and please someone who wants to leave. Compromise when you don't agree. Avoid trying to make someone else always see and do things your way. Let go of your need to control their actions. Instead, find areas of compromise to accommodate you both, and strive to find common ground all the time. Classic compromise solutions from dialectical behavioral therapy. I'll cut the pie. You choose the first piece. Mary divided the artwork into two groups following their divorce. Peter chose his preferences. Take turns. Peter prefers the mountains, but Mary wants the beach for their vacation. Their decision is to alternate between them both. Do both. Have it all. Peter wants dinner, but Mary decides on a movie. They make the decision to do both. My way when I'm doing it. Your way when you're doing it. Each person exercises their own method in handling problems. Tit for tat. I'll clean the bathroom once a week if you dust and vacuum every week. Trial period. Agree to a solution for a specific length of time, then reassess. Split the difference. Mary wants to vacation for 10 days, but Peter prefers to go for 5. Their decision is to meet in the middle and vacation for 7 days. Practice unconditional love. Agape. Practice loving yourself, others, and all forms of life everywhere, without exception or conditions. Agape is the highest form of love and is free of attachment, possessiveness, and dependency. It will be discussed further in a separate chapter. Exercise. Out of the dimensions of self-esteem noted above, which one are you afraid of losing, and how would you cope if it happened? Give examples of how to come up with compromises for current or past problems. Conflict, compromise. Non-attachment in parental love. Parents often navigate between conflicting recommendations. They hear on how to raise babies and children. Some parents respond to the caution against kissing and cuddling their offspring, whereas others will follow the extreme application of attachment parenting, which encourages parents to hold and cuddle their infants all the time, never leaving them alone, not even to sleep. The question could be, what is the most effective parental style? An authoritative parental style is perhaps the answer. The truth is that both tactile and loving human contact, along with a safe and structured environment, is necessary for normal emotional and physical development. This means providing affection and structure, along with freedom, to develop as an independent human being. To allow this freedom, it is essential to practice non-attachment in parenting, where a child's needs are responded to without demanding anything in return. Allow them to explore their world as much as they safely can, given the level of maturity at that moment. Teach them without demanding that they agree with you on everything. In this way, the child will feel accepted and free to follow their personal life path. According to psychologist Diana Baumrind, there are 4 parenting styles based on 2 dimensions: control or structure, and affection, love, and warmth. Number 1. Authoritative parents. Authoritative parental style is the most effective because it balances both structure and affection. It allows the practice of non-attachment by respecting a child's freedom according to the level of maturity. Parents who exhibit this style listen to their children and provide love and warmth in addition to structure or discipline. They are assertive, but not intrusive nor restrictive. They avoid punishment and threats, instead, relying on strategies such as positive reinforcement. This approach to parenting is equally demanding and responsive. Each child is encouraged to develop a unique and innate potential. Outcome. Children of authoritative parents tend to have high self-esteem, high grading in education, and high academic achievement, high social skills, conflict resolution skills, set boundaries, and show less involvement in drug abuse. Number 2. Permissive. Permissive parents provide more affection than structure. They are more responsive than they are demanding. Usually, children run the show and parents play the role of a friend, rarely using punishment or confrontation, and allow considerable self-regulation. Outcome. Children tend to have reasonable social skills, but low academic achievement. They are more involved in risky behaviors such as alcohol, drugs, unprotected sex, and gambling. Number 3. Authoritarian parents. Authoritarian parents provide more control than affection. They are highly demanding and directive, rather than responsive. Bedtime is bedtime. There is no communication, and providers expect their orders to be obeyed without explanation, and their beliefs and traditions followed without explanation. Outcome. Children of authoritarian parents tend to succeed academically, but not socially and psychologically. These children are often distant and passive, and struggle with repressed negative feelings such as guilt, fear, hate, and anger, all of which can cause anxiety and depression. Number 4. Uninvolved parents, neglectful. Uninvolved parents are low in both control and love. They are indifferent and not responsive to their children's needs, nor would they respond to basic needs such as shelter, water, and food. Outcome: children tend to perform poorly in all domains: academic, social, and psychological. They are more anxious, socially withdrawn, exhibit a lack of assertiveness, and are vulnerable to abuse and addiction. Healthy parenting involves healthy attachment, providing love, independence, and structure. Exercise. Number 1. What was your family parenting style, and what was the impact on you? Number 2. How would you practice the authoritative parenting style with your children? Let go of attachment to past experience. Healing the past. Understanding trauma, PTSD, and CPTSD. What is trauma? Before we discuss letting go of the effect that trauma has and how to practice non-attachment to past experience, we need to fully understand its effect on us. Emotional trauma is the result of any stressful or terrifying events, witnessed or experienced, that shatter our sense of security. It is not the nature of the event that makes it traumatic. Rather, it is the subjective emotional experience that defines an event as traumatic or not. Thus, the more frightened we feel, the more likely we are to be traumatized. Most people who experience trauma may have a temporary difficulty adjusting and coping, but with time and self-care, they usually recover. If the symptoms get worse, last for months, and interfere with daily life, the result may be PTSD or CPTSD. Traumatic experiences may include the following: one-time event, a major accident, injury, or a violent attack; ongoing stress, life-threatening illness, bullying, or domestic violence; social media and news, terrorist attack, plane crash, or mass shooting. Viewing these images over and over can cause severe anxiety. Other causes: surgery, the sudden death of someone close, or a breakup. A landmark study entitled The Adverse Childhood Experiences Study, or ACE, was done on 17,000 participants and found that a significant relationship exists between the number of traumatic experiences that occur early in life and negative outcomes later in life. Participants who were victims of emotional, sexual, and physical abuse, physical and emotional neglect, household dysfunction such as mental illness, substance abuse, and domestic violence, were found to have greater risk for many behavioral, physical, and mental health issues in adulthood. These issues include smoking, alcohol abuse, lack of physical activity, drug abuse, missing work, multiple sexual partners, sexually transmitted diseases or STDs, adolescent or unintended pregnancy, depression, suicide attempts, severe obesity, diabetes, chronic lung disease, stroke, cancer, and heart disease. Post-traumatic stress disorder, PTSD. Another complication of trauma is PTSD, a mental health condition typically triggered by a short-lived trauma or traumas of limited duration. Symptoms of PTSD may include the following: reliving the traumatic experience. Trauma is re-experienced through memories, nightmares, or flashbacks. Avoiding certain situations, large crowds, or driving that remind you of the traumatic event. Physical symptoms. These refer to physical symptoms that don't have an underlying medical cause. For example, you might feel pain, muscle tension, IBS, dizziness, etc. Changes in beliefs and feelings about yourself and others. This includes negative emotions, such as guilt and shame toward yourself, or bitterness and anger towards others. You might not be able to trust others or the world. Complex post-traumatic stress disorder, CPTSD. On the other hand, CPTSD, according to the International Statistical Classification of Diseases, ICD 11, is a prolonged repeated experience of trauma, most often the result of childhood shock. This can include chronic sexual, psychological, and physical abuse and neglect, chronic intimate partner violence, victims of kidnapping and hostage situations, victims of slavery and human trafficking, prisoners of war and concentration camp survivors. People with CPTSD share the symptoms of PTSD mentioned above. However, they may also report the following issues: attachment, insecure, problems with relationship boundaries, lack of trust, social isolation, and difficulty perceiving and responding to others' emotional states, altercations in relations with others, isolation and withdrawal, or a repeated search for a rescuer. Biology: sensory motor development dysfunction, increased psychosomatic symptoms, increased medical problems. Emotional regulation: poor emotional regulation, difficulty identifying and expressing emotions and internal states, and difficulties communicating needs, wants, and wishes, chronic suicidal preoccupation, compulsive or extremely inhibited sexuality. Dissociation, amnesia or reliving experiences, depersonalization, and impaired memory for traumatic events. Behavioral control, problems with impulse control, aggression, and sleep disturbance. Cognition, problems with planning, judgment, initiation, difficulty processing new information, difficulty focusing and completing tasks, and language developmental problems. Self-concept, disturbed body image, low self-esteem, excessive shame, sense of helplessness or paralysis of initiative, sense of being different from other human beings. Changes in perception of the perpetrator or perpetrators, preoccupation with revenge, idealization, a sense of special or supernatural relationship with a perpetrator, and acceptance of a perpetrator's belief system. Exercise: what is the emotional and physical impact of a rough upbringing? How do we let go of past trauma? There are multiple trauma-focused therapies, such as cognitive processing therapy, prolonged exposure therapy, eye movement desensitization and reprocessing therapy, and art therapy. We will review some of the non-attachment skills that help with trauma therapy. Letting go and forgiveness to overcome anger and resentment. Forgiveness is the decision to let go of negative emotions toward yourself, others, or events. Forgiving others enables you to let go of anger, resentment, and bitterness. When you forgive yourself, you can let go of guilt and shame. If you experience injustice or pain inflicted by another person, you have the option to hold bitterness within you or to forgive. Forgiveness allows you to release yourself from negative emotions. Once they are acknowledged, you can choose to dismiss them, offering them up to a cosmic judgment or a higher power. Forgiveness is a continuous process of replacing negative effects with acceptance, peace, empathy, and compassion. True forgiveness is a state of understanding the other person and the reasons for their behavior so clearly that you can truly say there is nothing left to forgive. Again, to forgive with the heart can take time, and it's an ongoing process. There are two types of forgiveness: decisional forgiveness, keeping negative emotions while forgiving, mindful forgiveness; emotional forgiveness, changes in feelings toward the offender as you forgive and release yourself from all internal negative feelings, heartfelt forgiveness. The desire to heal from past experience involves freeing yourself from resentment, bitterness, and other negative feelings. Essentially, you need to move towards emotional forgiveness. While decisional forgiveness may reduce hostility, it is not sufficiently effective in improving stress levels or emotional health. What forgiveness is not. It is not approving, denying, or overlooking negative behavior. It is not simply moving on. It is not forgetting or pretending nothing occurred. It is not the justification or letting go of possibly needing justice. It is not bargaining or negotiating. It is different from reconciliation, which requires a sincere apology from all parties. It is not dependent on the one you forgive, thereby transferring power to another to control and keep you in bitterness. It is not a restoration of full trust. Trust takes time to develop or be reinstated. The 4 phases of forgiveness, according to cognitive behavioral therapy. The uncovering phase. You improve your understanding of the injustice and how it has impacted your life. The decision phase. You make the decision to choose or reject forgiveness as an option. The understanding phase. You start to understand the offender in a new way, which will allow positive feelings toward the offender and you. The meaning phase. You may find meaning in the experiences and see the negativity as a learning opportunity. Uncovering phase. During the uncovering phase of forgiveness, your understanding of the injustice and how it has impacted your life will improve. Exercise. Describe the injustices in your life. What happened? How have the injustices affected you? Painful emotions, anger or shame, changed behavior, avoiding new relationships, practical costs, time or money, changed worldview, people are evil, cognitive rehearsal, recurring thoughts about injustice, physical harm, injuries from abuse. What feelings do you have towards the offender? Decision phase. During the decision phase of forgiveness, you will gain a deeper understanding of what forgiveness is and make the decision to choose or reject forgiveness as an option. Exercise. What are the pros and cons of deciding to forgive the person who caused you difficulty? Pros and cons. Describe how things might be different if you decide to forgive. The understanding phase. During this phase, you seek to understand the offender, which may initiate compassion. What was life for the offender like as they grew up? Parents, environment, neglect, abuse, genetic influence. What was life for the offender like at the time of the offense? List the feelings you currently have toward the offender after reflecting on these points. The meaning phase. During this phase, you may find meaning in the experience and recognize ways in which you have grown as a result. You see that a life crisis can be an opportunity for growth or resentment, for forgiveness or hate, to learn or to grow discouraged. The theory of logotherapy, developed by psychiatrist Viktor Frankl, was founded on the belief that human nature is motivated by the search for meaning. Frankl's theories were influenced by his personal experience of suffering and loss in Nazi concentration camps. In Frankl's book, Man's Search for Meaning, he wrote everything can be taken from a man but one thing: to choose one's attitude in any given set of circumstances. Exercise. Describe how you have grown and what did you learn from this experience. Writing a forgiveness letter. Writing a forgiveness letter can be a powerful tool to heal past wounds. It may take time, as it is different for everyone. You are not sending the letter to the offender, but you may share it with a counselor or someone you trust. The goal is to let go of negative emotions. The letter will consider the same points we discussed earlier. Include the following in the forgiveness letter. These were your chosen actions. Here is how they have impacted me and my daily life. Here is how their enduring presence affects me. If I can find forgiveness, here is how I envision better managing my life. Here is how I have come to understand your actions. Here is how I see forgiveness as the best way forward. Here are the clearest points I have taken and learned from all that has happened. Exercise. What have you learned from past negative experiences? Are you willing to forgive? And if so, how? Research on forgiveness. Research reveals that greater forgiveness and forgiveness interventions are associated with less stress, anxiety, depression, and other negative emotions, as well as overall better mental health. It is also associated with improved satisfaction with life, fewer physical ailments, better sleep quality, and reduced fatigue. A study looked at 20 psychologically abused and divorced women who were randomized between forgiveness therapy, FT, based on the Enright model, and an alternative treatment, AT, anger validation, assertiveness, interpersonal skill building. The study found that the FT group showed a greater improvement in forgiveness, self-esteem, state anxiety, trait anxiety, depression, environmental mastery, finding meaning, post-traumatic stress symptoms. Identify and replace trauma-related negative core beliefs. Identifying specific core beliefs caused by past trauma or negative experiences is an important part of recovery, as these are what shape how we respond to life situations. It isn't easy to identify and change these core beliefs. However, it's important to remember that while core beliefs feel true to us, that it doesn't mean that they are. You may say, "I feel like such a loser," but these feelings don't reflect the truth. Consider labeling beliefs simply as beliefs, rather than accepting them as true facts about yourself. Keep an open mind and recognize that misrepresentations can indeed feel true. The following is a list of the most common negative core beliefs as a result of trauma. Helplessness. The belief that you can't cope with a particular situation or with life in general. Worthlessness. The belief that you are unworthy or of no value. Failure. The belief that you aren't good enough or can't do anything right. Unlovable or unlikable. The belief that you are impossible to love, that no one cares about you, and that you can't make or keep friends or experience a romantic relationship. Abandonment. The belief that significant others will leave and that being alone is intolerable. Mistrust. The belief that others are untrustworthy, leading to a state of paranoia. Vulnerability. The belief that you are unsafe, relationally, medically, financially, or overly susceptible to being hurt. Emotional inhibition or repression. The belief that you must inhibit your emotions, as others will not understand them. Emotional deprivation. The belief that you will not get your emotional needs met within a relationship. Entitlement. The belief that you are special, or in some way, better than or more deserving than others. Narcissism is often a cover for insecurity. Punishment. The belief that you deserve to be punished. Insufficient self-control. The belief that you have no self-control, no ability to restrain yourself or delay gratification. This leads to impulsivity and addiction. Exercise. What are the negative core beliefs that you usually struggle with, and how would you change them? Non-attachment and letting go of past errors. Forgiving yourself. Difference between guilt and shame. Guilt and shame are closely connected emotions. We tend to feel guilty when we believe we have violated rules that are important to us, or have not lived up to the standards we have set for ourselves. Shame fosters a sense of being flawed, no good, inadequate, rotten, awful, or bad. Based on cognitive therapy and the 12-step program, here are some questions and skills to help us let go of guilt and shame. Number 1. What is the full measure of the damaging action or actions? The following question should be asked to weigh the severity of your actions. How do others' judgment of my actions compare with the extent of my guilt? How will I view my responsibility about the damage in 1 month or 1 year? If the same actions had been directed toward me, how would they have affected me? Would the outcome of my actions have occurred to me before I had acted on them? What was the extent of the damage? Number 2. What is the full measure of your accountability? After an evaluation of your actions, it's helpful to consider personal accountability, listing everyone, including yourself, that contributed to your feelings of guilt and shame. Identify what percentage of accountability you see as yours. Number 3. Breaking the silence and making amends. Steps 5, 8, 9, and 10 of the 12-step program. Step 5. Breaking silence. We admitted to God or a higher power, to ourselves, and to another human being the nature of our wrongs. In this step, you are invited to admit your wrongdoing to yourself, to your higher power, and to another human being. Sit with another person and reveal the nature of your wrongs. As much as you are able, it is important to discuss all details. Don't minimize or exaggerate your wrongdoings. If you cannot remember details, simply make your best effort. Telling the truth brings a great sense of relief, no matter how unpleasant the details may be. Consider this quote from AA: "You're only as sick as your secrets." Again, it may be frightening to share secrets, but you will feel tremendous relief once you get it all out. Keeping secrets inside and dwelling on your faults will only allow shame to grow and torment you. A good sponsor, a doctor, therapist, or friend will never judge or condemn. Admitting faults to another human being is essential to heal. It will free you from guilt and shame, both of which are the results of accumulated wrongdoing. Step 8 and 9. Making amends. Step 8. Make a list of all persons we had harmed and became willing to make amends to them all. Step 9. We made direct amends to such people whenever possible, except when to do so would injure them or others. Step 8 requires that you make a list of all the people you have harmed and are willing to make amends with. There may be people you think of as unbearable to talk to, which is why it's best to write the list without overthinking. It's important that you list all of the people you have harmed, whether sexually, physically, or emotionally. You need to clean up your side of the street. In other words, be willing to do your part in making amends and leave the results to a higher power. You cannot expect to be forgiven by each person. Step 9 requires you to make amends whenever possible, directly to those you have harmed, except when this would cause more harm to them. That is why it is vital to have a trusted person or counselor with whom to evaluate how each person should be handled. Every situation is different, and in some circumstances, it is better to avoid direct contact to make amends or avoid sharing all details out of compassion for that person. If a husband has cheated on his wife, though it's necessary to admit that infidelity, it is not advisable to name names or to go into unnecessary detail. Motives should always come from your desire to truly repent for the hurt caused and a genuine wish to offer the best for others. An apology is necessary, but not sufficient. You may want to compensate directly to those you have hurt, but this will not be effective without a change of attitude and behavior. If you stole money or lied on expense reports, AA states all those debts must be admitted to and paid back, over time if necessary. Sometimes speaking with a person is impossible because of death, distance, or abuse. But while they may not be near you, the negative feelings attached to them are still there. If you want to be at peace with yourself, be willing to be at peace with them. If for any reason it is not possible to make amends directly to them, you can write a letter, pray, or use the empty chair technique. Set up a chair in front of you, then express your feelings aloud. It takes courage and humility to admit wrongs, and there are many barriers that can interfere with your willingness to make amends directly. Shame is often the cause of inner resistance to apology. You may also fear a person's anger, worrying that the person you have wronged is upset or furious. Perhaps you have been taught that an apology is a sign of weakness, or you might feel residual resentment, believing that the other person was in the wrong, and now you expect an apology. You may also think your apology is too late, or that it isn't a big deal. The truth is that all those resistances are likely based on your distorted ego perception, which is keeping you from healing your heart. Exercise. Please make a list of 3 persons you have harmed in the past. Describe how you harmed them, and how are you going to make amends. What barriers are interfering with your willingness to make amends directly? Is there a way to overcome them? Step 10. Personal inventory. Continue to take personal inventory, and when we were wrong, promptly admitted it. Step 10. Suggest that you continue to take personal inventory, as well as admit any new mistakes as you go forward. A simple way to do this is to pause in the middle of your day, and when you retire at night, take a quick assessment of things. Ask yourself, was I resentful, selfish, or dishonest? Do I owe an apology? Was I kind and loving toward all? What could I have done better? In addition, reflect on the good things that you accomplished and give yourself credit for them. In doing so, try not to exaggerate or dramatize your limitations or your strengths. Number 4. Self-forgiveness letter. This involves learning to view yourself with the same kindness and compassion with which you view others. A self-forgiveness letter will help you let go of guilt and shame. Write the letter using the following steps. I must forgive myself for these wrongs. My wrongs impacted others and myself in the following ways. Did my life experiences influence my behavior? Here is what I was able to gather and understand from my experiences. Exercise. Write a self-forgiveness letter. Other ways to practice non-attachment. Self-control. Make a list of the habits you want to control and work on. Employ the help of someone close to you, or a counselor. Then choose the behavior you'd like to control. Perhaps it is smoking, eating, work habits, alcohol, your temper, shopping or spending money, etc. When the habit is recognized and acknowledged, set realistic, achievable goals for yourself. Always consider time and avoid dramatic or unsustainable changes. Remember that you're in control of your behavior while making choices. Generosity and simplicity. One of the cures for attachment is learning how to practice simplicity in life and giving to others. Simplicity is a state of mind. What matters is not what you have, but how you hold what you have. Spiritually evolved people see possessions and worldly things as irrelevant and temporary. They neither seek nor desire material gain. Instead, they feel more pleasure in sharing with others. And this is especially true for sharing the gift of love and dharma, which means the gift of truth. See the impermanence around you and let go of possessiveness. Attachment is reinforced by the denial of the impermanence of worldly things and extends the illusion of possession. To see that all worldly things are transitory can facilitate the letting go of attachment. The inevitable truth is that everything is subject to change and loss. Part of non-attachment is understanding that people and the world around you will change. Not only will you have to allow your life to change, but also yourself. Your children will change, your friends will change, your routines will change, and your living situation might change. As ancient wisdom reminds us, ignorance of impermanence generates attachments and therefore suffering, sickness, and fear of death. Sometimes your best teacher is death. As it happens, you realize that one day all worldly things will be taken from you, and what will remain is love you have given. For this reason, it is wise to meditate, even on death, and on the nature of transitory things. You may also need to remind yourself that you do not own anything on earth. Everything belongs to the world and goes back to the world. Psychologist Jean-Yves Leloup has said, "To look at an object, a person, or a landscape with love and without attachment, with no desire for appropriation of it, is to see it more clearly. We were not created to possess, but to be with. To think that we can really possess any object or person, even our own bodies, or our own thoughts, or our own lives, is an illusion." Meditation, mantras, and prayers. Meditation will allow you to practice non-attachment, and you will begin to observe and witness that you are not your body, possessions, thoughts, or emotions. Try to meditate for at least 10 minutes initially and extend this time daily. When you meditate, take up the position most comfortable for you. Rest and relax. Tell yourself to relax and release all your limbs as well as your head, neck, and face. While meditating, focus solely on the present moment, letting go of worries about the past or future. Focus on your breathing, and if you feel your thoughts rising, do not interact with them. Simply witness your thoughts and let them go. It is in the stillness and silence of the mind or psyche that you may get to know the one who is watching the voice, the true self. You have the potential within you right now to experience this peace and joy. Mantras and prayers are great antidotes for attachment. You may pray to surrender all cravings to your higher power, and repeat daily mantras to help release you from possessiveness, attachment, or desire. The following is an example of mantras or sentences. Nothing in this world belongs to me, whether it be an object, person, my own body, thoughts, or knowledge. I am not my body, nor my thoughts or knowledge, nor my emotions, nor my possessions. I was not created to possess, but to be with. I am okay with or without. Value everything, but become attached to none of it. Recognize that you don't know everything. Part of being non-attached means recognizing that we don't know everything. We live in a full-dimension movie, where we become deeply absorbed by all experiences, whether physical, mental, or emotional. We can pull back and see that what is perceived is an illusion, a projection of our own level of consciousness. Ask yourself, who are you? If you go to the depth of the question, you will clearly see who you are. Not your name, which is only a collection of letters. Not your body. If you lose your legs, eyes, etc., you still exist. You are not your emotions, all of which come and go, whether you are bored, in a good mood, angry, or depressed. Not your thoughts. If you have Alzheimer's, you could lose connection to all thoughts, but you would still exist. You will come to realize that what you truly are is the witness, the observer, the experiencer. Letting go of emotions of desire. Let go of the energy of desire, like dropping a pen. Be aware of the feeling and feel it in your body. Don't condemn or moralize it. Just let out the energy behind it. Let go of wanting to resist it. Let go of the fear and guilt that accompanies the process. Ignore all thoughts and focus on the energy of the feeling. Thoughts are rationalizations of the mind. If you get stuck, surrender the feeling of being stuck. Imagine you will receive a $10 million check if you can let go now. Sedona method. Allow yourself to feel the feeling, then ask or write the following. Could I let it go? Would I let it go? When? How do I feel now? And keep repeating these questions. Let go of expectations and attachment to outcomes. Do your best and expect nothing in return, as it is often your expectations or attachment to outcomes that can cause disappointment or other negative feelings. If things don't go as expected, focus only on what you can do in that moment. Try to let go of your need to control life events, and also control the power others have over your happiness. When circumstances severely upset you, it is an indicator that you are clinging to an expectation, idea, person, or thing. When this happens, try to focus on your breathing. Step away so that you don't react. Return when you feel at peace. If it rains on your wedding day, have your first dance in the rain and find something in the situation that you can enjoy. Clinging to the desire for your wedding to be on a clear, sunny day will only create worry and stress. Practice the Paradoxical Commandments. The Paradoxical Commandments is an inspirational poem written by Dr. Kent M. Keith, an American writer and leader within higher education. These guidelines are found detailed in his book, Anyway, The Paradoxical Commandments, Finding Personal Meaning in a Crazy World. Kent's main idea is to encourage people to be kind and loving toward others by letting go of expectations and attachment to outcomes. The 10 Paradoxical Commandments. People are illogical, unreasonable, and self-centered. Love them anyway. If you do good, people will accuse you of selfish ulterior motives. Do good anyway. If you are stressful, you will win false friends and true enemies. Succeed anyway. The good you do today will be forgotten tomorrow. Do good anyway. Honesty and frankness make you vulnerable. Be honest and frank anyway. The biggest men and women with the biggest ideas can be shot down by the smallest men and women with the smallest minds. Think big anyway. People favor underdogs but follow only top dogs. Fight for a few underdogs anyway. What you spend years building may be destroyed overnight. Build anyway. People really need help, but may attack you if you do help them. Help people anyway. Give the world the best you have, and you'll get kicked in the teeth. Give the world the best you have anyway. Humor in the moment. Don't take yourself seriously. When you feel the need to cling to someone or to an experience, find humor in the moment. Laughter is the inner child in you that sees the world with wonder and joy. If you can laugh heartily, see the absurdity within any situation where there had been hurt or repulsion, you will release a great amount of tension and stress.